Good morning, everyone, or afternoon or evening, wherever you are in the world. My name is Athas Nikolakakos, and I'm the lead product manager in Facebook's response to harmful health content on its platforms. Before I begin, I would really love to thank the WHO for inviting us to speak today, and also for our partnership in responding to COVID-19 and other health crises. Today, I'd like to spend our time talking about just a few of the ways that Facebook is responding to COVID-19, and also the opportunities that we think to do more, particularly with organizations like the WHO and ministries of health and other expert health organizations in the world. Before we even talk about the way that Facebook might try and amplify credible or authoritative sources of information, Facebook is a platform where people and organizations come together on their own, and they share their experiences and their information. And as often is the case in times of crisis, we're seeing people do it in remarkable ways. So for example, right now, it's really important that people get critical messages. And this is something that social networks can do really efficiently. And so we've already seen governments and health departments and media get the word out using our platform. This is cases like the presidents and prime ministers using Facebook to announce quarantines or travel restrictions, or even local, municipal, or state health departments using it to keep their communities informed. Media outlets and global health organizations have hosted Q&As on Facebook so that people can get their most pressing questions answered. Now, those are examples of, let's say, governments or large organizations, but we're also seeing individual doctors and researchers and academics share their own lived experiences. So people on the front lines are giving firsthand accounts of their experiences on the outbreak. For example, there's an anesthetist in Italy who goes live from her hospital to talk about the impact of healthcare services, or doctors who reassure people about what it's like living in quarantine. We think that social networks have a unique role to play in giving people the ability to quickly and widely share their stories this way. One of our goals is to support the global public health community's work to keep people safe and informed during this coronavirus public health crisis. And so we've really adopted a twofold strategy. First is that we want to connect people to accurate information from credible and authoritative health authorities. And second, we want to stop the spread of misinformation and other harmful content. Let me start with number one, how we're connecting people with credible and accurate information. First, we launched the Coronavirus Information Center. It's featured at the top of the newsfeed and provides a central place for people to get the latest news and information, as well as other resources and tips to stay healthy and support their friends, family, and community. It includes real-time updates from national health authorities and global organizations like the WHO, as well as helpful articles and videos and posts about social distancing and preventing the spread of COVID-19. We're also making sure people get this information elsewhere in our products. So for example, on Facebook, if you search for coronavirus, or if you join a COVID-19 related group, you'll see a pop-up that directs you to the WHO or your local Ministry of Health. If you're in a country where the WHO has reported person-to-person transmission, you should have also seen this pop up in your newsfeed. On Instagram, for example, if you tap on a hashtag that's related to COVID-19, we'll also show a pop-up showing or providing you resources or access to the WHO or other health authorities. To give you a sense of the scale, as of a couple of weeks ago, we had directed over 1 billion people to expert health resources, 100 million of which clicked through to learn more from these sources directly. It's a huge number. Outside of these pop-ups, we've assisted the WHO and other health organizations to connect with celebrities and influencers so that they can amplify their own organization's public health campaigns. This includes campaigns like Safe Hands, Heal at Home, and Stay Home. We've given the WHO as many free ad credits as they need for their coronavirus response, and we'll give support and millions more in ad credits to other organizations. This includes ad credits to our global fact-checking partners to boost their fact-check articles related to coronavirus misinformation throughout the newsfeed. To give you an example of how we're handling this in the messaging space, we helped launch with the WHO a health alert on WhatsApp. People can sign up to receive alerts with daily reports on the latest numbers of COVID-19 cases. It also includes tips on how to prevent the spread of disease, as well as answers to commonly asked questions that people can easily send to their friends and families. Again, to give you a sense of impact, in just the first week, we saw over 100 million messages sent to WhatsApp users. Moreover, in the US, we're helping local governments and emergency response organizations more easily communicate with their communities by expanding access to Facebook's local alerts to local public health agencies. That gives you a sense of just some of the ways we're working hard to connect people with credible and authoritative information about COVID-19. But let me move to the second part of our strategy, which is focused on stopping the spread of hoaxes and harmful misinformation. So let me start with that we remove false claims that have been flagged by leading global health organizations that could lead to imminent physical harm. So we'll remove posts that make false claims about cures, treatments, the availability of essential services, or the location or severity of the outbreak. We regularly update these claims based on guidance from the WHO and other health authorities. Let me give you a few examples. So this started with taking down cases or dangerous claims like drinking bleach to cure coronavirus, which a previous presenter also talked about, and also now includes claims that physical distancing doesn't work. For a different set of claims that don't or couldn't directly result in physical harm, like conspiracy theories about the origin of the virus, we work with our global network of over 60 fact-checking partners that cover 50 languages to debunk these claims. Changing perspective to the ads front, we block people from running ads that try and exploit the situation. Let's say, for example, by having a product that claims to cure the disease. We've also temporarily banned ads and commerce listings for medical masks, hand sanitizer, disinfecting wipes, and COVID-19 test kits in both ads and commerce listings. Again, on the messaging side, for example, on WhatsApp, we've built clear labels to show the users when they've received a forwarded message or chain message, so they're aware that they received something that wasn't written by one of their immediate contacts. We've also set limits on the number of times messages can be forwarded in WhatsApp to reduce the spread of viral messages. And we use advanced machine learning techniques to identify and ban accounts engaged in mass messaging. And to give you another perspective on this, we're working to support newsrooms and fact checkers to promote quality information and fight fake news. We've given $100 million investment to support journalists. That's $25 million in emergency grant funding for local news through the Facebook Journalism Project, and another $75 million in marketing to get money to publishers around the world at a time when their advertising revenue is declining. We've also offered a total of $2 million in grants to increase fact checkers' capacity during this time. That's just a very high-level summary about our two-pronged approach to connect people with authoritative information. But we know we can do more, and especially when we bring together technology companies, expert health organizations, and ministries of health, and we work together more closely with them, we can have more impact. So I'd like to talk about maybe a few opportunities that we think lie ahead. So two places where we think a closer collaboration would be most helpful. First is in creating content that resonates with the world's diverse population and meets those people where they are. And we want to find a way to collaborate and enable the World Health Organization, the ministries of health, and other authoritative or expert health organizations to be their own best advocates on social media, to reach the audiences that they care most about, and to do it with the most impactful, resonant, and helpful information for the audiences that they're targeting. This means content that is relevant to them based on their geography or other factors, and that's in their native language. The second thing is to encourage or develop ways for better sharing of potentially false information trends between us. We, as Facebook, want to learn quickly about the new hoaxes and misinfo that you or experts or individuals are seeing on the ground and hearing in each country around the world. This helps us improve our own processes and find and act on that content when appropriate. We also want to find ways to support the WHO and others' own myth-busting campaigns. Because when the WHO or other health organizations publish content that corrects false information, it gives Facebook the basis to take action, to evaluate that content against our policies, and to take additional action. It also gives us additional places to link users to share that credible source of information. And that really links back to helping these organizations create content that resonates with their intended audiences. So we'd really love to find a way to collaborate on this front and explore how to produce the most relevant and engaging fact-checking or myth-busting content for all the populations around the world. Those were just two of the opportunities that we saw, and I'd really like to thank you for listening to us on how we're approaching the misinformation on COVID-19.